Hello, everybody. Good afternoon. Welcome to this webinar on aquatic therapy principles and practice. It's great to see so many of you here this afternoon. So for those of you who hasn't joined one of our webinars before, my name's Graham Oliver and I work at this company, Yorkshire Care Equipment. And we've been supplying care and rehabilitation equipment into both community and acute settings for 50 years now. It's our 50th birthday this year. So I'm just going to give you a very brief overview of some of the things that we do. So for those of you who are occupational therapists, one of our main focuses is specialist seating, and it's for rehabilitation and care. We cover paediatric right through to bariatric across the whole of the UK. And for those who are involved in rehabilitation, we've got a new product which has just come out, which is called the Stair Trainer, and it's basically a flexible, adjustable height staircase which can be used in to improve early rehabilitation and get people mobilized quickly after operations, etc. And it helps improve recovery rates and chances. So if you're interested in seeing more of that, then just leave us a comment in the chat and we can arrange a demo after this webinar. So in terms of why we have got this information around aquatic therapy, Yorkshire Care is actually part of a core care business, a core care group of companies. We have a sister company called Innova Care Concepts, whose details you can see on the screen there, and they provide hydrotherapy pools. But as we're heavily involved in rehabilitation, we want to bring people together who work in the rehabilitation setting, and the aquatic therapy is certainly something which I'm interested in, don't know much about, so I'm very much looking forward to this presentation. And so without any more information, we're going to pass you over to Marcelo Rohde, who's going to talk us through this. Over to you, Marcelo.
Perfect. Thank you very much, Graham. Yes, hello, everyone. Good afternoon. Thank you very much for the invitation. I want to talk to you, invited by the guys from Yorkshire, just to talk a little bit more about aquatic therapy, or hydrotherapy, as it used to be called, and still is called somewhere. I work at the Royal Buckinghamshire Hospital. I've been working with rehabilitation for the last 15 years or so, and I've been working with hydro at the same time as well, with different types of clients, different types of patients, but mostly with neurological patients. So I'm going to be a bit biased towards neurological, though I see some SK patients, and I used to work with kids in the past as well. This is going to be a bit biased towards neuro. And as Graham suggests, there will be a Q&A at the end, and then we can go through it. So let me just open my screen here. Good. Perfect. All right. So aquatic therapy. So that's so they changed the nomenclature recently, just to be a bit clearer what we do. Yeah. The use of water. So this is the use of water in our rehabilitation process, in our therapy process. But water has been used forever, yeah, for a long time, you know, from the time of the Romans and etc. Okay, so since the times of the Romans and the Greeks, they've been using these baths, you know, for relaxation process and for therapeutical purposes as well, yeah. And then, you know, later on, they found these springs, especially the monks in Switzerland, that they found some springs, and this is since the 15th century, they've been using for all its therapeutical purposes, and people would go there and stay for days or weeks just for relaxation, to pain relief, and etc. And then since then, we've been using that, and nowadays we continue to use, you know, water as a means of relaxation, as a means of fun, as a means to exercise, and as part of as rehabilitation as well. Yeah, so water is much more involved, and it's very interesting what happens to us once we are in water, especially when we are in a relaxed environment, is always very interesting, because especially men, we tend to get a bit silly in water. There is a release of testosterone, and especially men, we tend to get. But there is this relaxation. If you go to, if you have a hot bath, if you go to a jacuzzi type, or if you go and swim in icy waters, the way we respond is different as well. Okay, I'm going to talk a little bit of that, but I think what I want to focus is on the rehab purposes, on the hydrotherapy point of view. When I talk hydrotherapy pools, I'm not going to go to the extremes. The idea is to work on that. Okay, so we have our Aquatic Therapy Association of Chartered Physiotherapists, that an arm from the CSP, and that's how they identify what aquatic therapy is. But simply is, for hydrotherapy or aquatic therapy, is the use of water in the assistance of rehabilitation and therapy. Yeah, you get the immersion, so you get all these responses on your body, both physical, physiological, and then there is a psychological, psychosocial element to it as well. As I said, that we get silly. There is a component to that as well when we get in the pool, and then this is something that we could use then. So these hydrotherapy pools, they are purpose-built. Yeah, they have a certain temperature, they have certain size, just to stimulate that. Yeah, the hydro is something that complements the treatment on land. Okay, and then you can see different type of clients as well. Anywhere from MSK injuries to pediatrics to the neurological, elderly care, and on and on and on. Yeah, so we see a lot of people come, especially with hip replacements, knee replacements, low back pain, but then kids, they go from anywhere to MSK injuries, but also to neurological, cerebral palsies and all of this. Yeah, and then neurological as well. We where I work at the moment, we are a rehab center. The Royal Buckinghamshire is a rehab center, and we are focused only on neurological problems, mainly in spinal cord injuries. So this goes from very low level and very mobile patients to very high ventilated patients, very high injuries, and etc. So we have a different scope of clients that we get in the pool. Okay, so we need to think what happens then. What happens when we are immersed in water? Okay, so what changes should we expect when we get in water? The first thing we can notice is it's from the Pascal law. It's something about the pressure. Yeah, is that the pressure is distributed all around the body. Yeah, but the thing is, the deeper you go, the more pressure it will exert on the body. So as you see by the arrows, there is more pressure towards the feet than there is towards the head if you are standing. Yeah, that's why if you are diving, for example, the deeper it goes, the more protection you need, and you need to work on levels of oxygen and nitrogen as well on your mix to compensate for that. But this has got an effect on how the fluids, how water and blood circulates in our body. So if you have more pressure around your legs, the permeability of the capillaries, they increase, but also it generates a bigger pressure, increasing the venous return. And then this creates an overload on the heart as well, which then increases the cardiac output. So we have this increased cardiac output, but at the same time we have this permeability of the capillaries. So that's where you can help with edema management. Yeah, because if you have this pressure that is higher, of course it's not this massive difference between when you're talking about 1 meter or so, but there is a difference, and then this helps with the lymphatic drainage as well. And then the same way as this pressure puts overload on the heart as well and increases the cardiac output, this same is going to happen when you go to when we talk about the kidneys as well. So it puts extra pressure there, and then there will be more excretion of potassium, of sodium as well, calcium. And then, of course, this will increase the diuresis as well. So that's why when we stay in the pool for too long, we have to go to the toilet. Yeah, usually straight after. Yeah, we feel like we have to go to the toilet. And then this is something that we have to keep in mind, especially with the neurological population. Yeah. So one thing that could happen is dehydration, quick dehydration. So it's always nice to have some type of liquid, ideally water, but it could be some sugary drink as well by the side if there are significant changes in blood pressure or hydration. The other thing that happens, especially with the spinal cord, or someone with some sort of catheter that is blocked when they get to the pool, sometimes this will increase the pressure on the bladder as well. And then if they have a high enough spinal cord injury, this could lead to autonomic dysreflexia then. So it's something to keep in mind once we get these patients in the pool as well. The other thing that will happen is because you have this pressure that goes all around your body, this compresses the rib cage as well. Yeah. So we're going to have to put more effort into expanding the rib cage when you're breathing. So you can use this as a training. You can use it almost as if there was an elastic band around the rib cage and you're trying to force it. But there will be more resistance to breathing. So your vital capacity should reduce, especially the deeper you go. But then at the same time, there is less response from asthma, from exercise-induced asthma when you're there, because of this as well. Okay, so, and then when you start to look at that, you see what happens to the heart, what happens to the lungs, what happens to the kidneys and to the body. You can come with some contraindications why you wouldn't put someone to exercise in the pool. And to be honest, the contraindications are pretty much any contraindications that would stop you from exercising in general. Yeah. If you got someone who is feeling unwell, that you wouldn't exercise in the same way. Someone who is completely unstable, you wouldn't get as well. Yeah. Someone with shortness of rest, chest pain, you would even do exercise. Yeah. I think the only thing that changes is sometimes people get extremely anxious. So if it is someone who's completely against, then of course you wouldn't, afraid of water and anxious, then of course you wouldn't get. Some open infected wounds might be a problem. Yeah. There are a lot of precautions that we need to be aware. Yeah, but there are precautions, then they need to be assessed patient to patient. Okay. So what happens then? The other thing that happens is once we are in water, we are lifted. Yeah, we feel this buoyancy effect. Yeah. So there's something called the Archimedes principle that said that the amount of weight we move when we are in water, this is the amount of support that we're going to get from this buoyant force, which is against gravity as well. So this is important to know, because the thing is, the deeper you are in water, the lighter you will feel. Yeah. So this is roughly how much lighter you feel, depending how immersed you are in water. So if you are about waistline, you are about 50% of your body weight going through your legs there. If you go like sternum is about 30%, the neckline is about 90% or so, 95, if you go to the chin line. And then, of course, this will have implications, because this makes it makes you much lighter. And as you are lighter, maybe you can do more. But at the same time, you end up feeling so light that sometimes you lose balance. Yeah, you cannot control balance, and you don't have as much sensory feedback. So this is interesting when we are choosing who our patients are and who are the therapists, when we try to pair patient therapists, and also when we are designing a pool, we have to take this into consideration. Yeah, because we got there, let's say, two therapists of different heights on the image there. Someone who has got water by the umbilical cord. They are about 60% of relief of buoyancy there. So they're about 40% of the body weight there. But someone who is about neckline, yeah. So it's much harder for you to control yourself, to control your body when you're feeling so light, because you don't have your anchors to stabilize, especially when you are working one-to-one with a patient as well. Yeah, so usually when we have this, we have to counterweight this, for example, by putting ankle weights. Yeah, so I have colleagues that in our pool, they're quite short, so they use ankle weights, and sometimes we do that for the patients. Yeah, and knowing this is interesting, the way the body behaves, because for example, let's say if you got someone with an ACL injury, they just had surgery, and then the surgeon says that they can only put 50% of body weight over that leg. It's very hard to control this outside, but if you know that the water is about umbilical line or waistline, you know is roughly around 50%. Yeah, so then you can freely load that leg without worrying that you're putting too much weight on it. Yeah, this is the same for hip. And it's interesting as well how it works for people with arthrosis, arthritis, and etc. Sometimes just having this amount of weight taken off, it means that they will feel less pain and they will be more able to mobilize then. Yeah, so this is the dead sea. So that's when the density is different, because usually all the waters are created with chlorine, but they can be treated with salt as well, and then the density changes. So this is the Dead Sea, which the density, the concentration of salt is very high. Yeah, so then you have people floating and reading newspaper and etc. So this changes, and not only the density of the water, is the relation between the density of the object or the person and the fluid you're immersed. Yeah, so different types of body, they will have different reactions to buoyancy and flotation. Yeah, so usually what happens is, if you get usually women, an older person, someone who has got more body fat, someone who is low tone, all these characteristics, they will tend to make the person float more. That's why usually women tend to float better than men. Yeah, as a rule. Even we can even look, for example, at race. Yeah. So if you got someone, usually a Caucasian, and someone who's black, usually the difference in type of fibers changes as well, and this can also have an effect on how well you float or you sink. So usually skinny people, men, someone with high tone, spasticity, they will tend to sink as well. So this is another consideration that we need to have to see how much support we need, how the person will react with our exercises. Yeah, and then there are different devices that we can use to compensate that, either to compensate or we can use as resistance, taking flotation into consideration. Yeah, so different noodles and ankle floats and dumbbells and etc. So for example, if you look on the left side here on the video, the first exercise is using flotation as a resistance. Yeah, in the same way as we use dumbbells outside, the only difference is that now the vector is pointing up. So he's just doing like type of lats type of exercise for the arms. And then on the right side, the float is using for the opposite. Yeah, it's using to support his trunk and to facilitate movement. So it depends what we're trying to get out of this. The other thing that changes is, because usually when we are on land, we have one force, which is gravity, and that's acting upon us. But now we have an opposite one, which is this buoyancy, flotation. Yeah, as you can. And what happens is, if you got someone floating and these two lines, they are aligned, then the body is stable. Yeah, and then we have this metacentric effect, or you have this point of metacenter. That's where the alignment between these two forces. Yeah, if they align like they are here, it's fine. The person is floating, no problem. But usually what happens, especially with men, our legs tend to be much heavier. The distribution of our weight is much more towards the leg. So what happens then is our center of gravity is shifted much more to the legs. And then usually what happens, the feet go down. Yeah. So then you have an imbalance, and then that's where it shifts. Yeah. And that's why ships, they are the way the shape of the hull is the way it is, because when you have that shift, it changes the way, and then the point of buoyancy changes, and then you keep a shift floating. Yeah. But you can use that. So knowing that by changing the center of buoyancy and changing the center of gravity will have an impact on the way you use that. So you can use this in our favor. Yeah. So for example, what happened is, if you compare these two pictures, his hands are down. So the center of gravity, the mass is mostly concentrated towards the legs. The moment he puts his arms up, the center of gravity shifts up towards the torso. And then now we managed to find the center of buoyancy, and they are aligned. So this meta center is there, it is stable. So knowing this, we can then play around, and we can play. So the same way it works up and down, we can work in all directions. Yeah. So you could use one arm and facilitate rolling, or like we have on this next video. If you look at his head, so he's floating there, so he's mobilizing. And then at some point, he's bringing his head forward, and this helps him to sit up. Yeah. Of course, there is a combination with the others, but knowing this weight shift, it helps you to mobilize. So again, head comes forward. This helps the hip to come down, and then it helps him to turn forward. Yeah. And as we move, then the other thing that can happen is this flow. Yeah, you have this flow, and then this generates this drag, and it generates a negative pressure behind. So you have mama duck in front there, and you have this, shall I say, this ripple effect behind. And then what happens is this creates a negative pressure behind, and it's much easier for the ducklings to follow. So again, we can use that. This way that they're using here, the duck is using this to facilitate the ducklings in the same way as we can facilitate movement. Yeah. So we can use this drag, we can generate movement, and the moment we stop, there is still the drag that continues to mobilize, let's say, a limb, if it is a leg, an arm, etc. And you can use this as a facilitator exercise. But in the same way, we can generate drag and create resistance. So depending on how you execute and how you set up your exercise, you can either have an assisted exercise, or you can have a resisted exercise. So in line with that, what happens, and so let's say if we get, a bus and a sports car driving, yeah, there is much more area in front of the bus than there is in a sports car. So this generates these vortexes. If it's a bus, we see these air vortexes that drag, that create resistance. And you don't see as much when you have a sports car, for example. Yeah. So then knowing this allows us to play. So if you have our hand moving, let's say here from the right to the left, this will generate the same impact if you're going through a fluid. So if you have your hand facing the movement, you're going to have much more area, so you're going to have much more resistance. And when you turn, you're going to have much less resistance. There's the same movement, but you're applying different resistance. And that's one of the ways we can play with load with the exercises. Yeah. And then same way as if you're driving, let's say a bus, in town, the resistance is minimal, yeah, because the movement is very slow. But the moment you put a bus on the motorway, all this front area, it generates a lot of resistance. So there's much more resistance when you're going faster. So this is the other way that we can explore movement and resistance and load progression with our clients as well. The faster you move, the more resistance you get. Yeah. So sometimes the same movement can generate an assisted, a very light, or a very heavy. What usually happens is that once we get to a certain speed, you won't be able to accelerate much more than that. you will be able to produce all the power you have, but you keep the constant resistance throughout the whole arch. Something that, for example, we don't get when you're using like pulley systems, because the angle is always changing. So this, if you reach this speed, you can maintain the same load through the arch there. Yeah. And then the thing is, the faster you go, this resistance is not only duplicate, is the square of this. So yeah, so faster movement, it means a lot of resistance. Yeah. And then there are ways to increase this area. Yeah. This like frog-like gloves and etc. And then have this palmar type of support that you can use to generate a bit more drag. Yeah. So again, if you pay attention, if you look at the position of the dumbbell now, can you see that the round, so the lateral facing of the dumbbell is facing the movement? Yeah, both going in and out. Yeah. So this is just to increase the area of this frontal area that generates a little bit more speed. The other thing is, this compared to the other videos is moving much faster as well. And then you can see these vortexes, behind the movement there. But what is interesting is that when you talk about this implement, this equipment, we also is a flotation device. So not only we have to think about the direction of the movement and how this frontal area is, but he's also pushing down. There's also a force pushing this dumbbell up that he needs to counteract. Yeah. So there are so many forces going. And then this force is not only on the arm, they are also happening all around the body. Yeah. And you can progress. So for example, now on the first one, he has got his left feet on the, he has got both feet on the ground, and then his back against the wall. On the right side, yeah, it's a bit too noisy. And then on the right side is a progression, because now you don't have more the support behind his back now. Yeah, it's a more advanced progression there on the same exercise. Okay, so there are so many forces acting at the same time. When you think about all these forces that we think when we are preparing an exercise, when we're choosing an exercise to do on land, now we have this extra speed of movement, buoyancy, points of contact, because once you are in water, especially when you're deep like that, they are very light, your body will have to move constantly. Yeah, your balance will be lost because there is less weight going through your legs as well. So the way you have to adapt and the way that you have to stabilize is very different. And then all of this needs to be taken into consideration as well. Where are your points of contact? Can the person stabilize it? So sometimes we're doing this exercise I've just showed that. Sometimes they're arms exercise, but actually what we're looking is, how is this pelvic stabilization? Are we radiating to the legs? And that's so all those things that we need to keep in mind once we are prescribing exercises in water. Yeah. So once we're ready to get someone in the pool, we need to think, why are we getting there? We have this usually an initial assessment that we want to go through all these contraindications, any precautions that we should have. Is the person continent, is incontinent, do they have open wounds, do they have any infections, are they pregnant, and etc. So all of this, they will have impact on the way you see this patient. And then you need to see, how are they in water? Are they afraid of water? Are they, we need to assess to see what can we then offer within our toolbox. What can we offer? Yeah. And then this is also, we have to look at how do these people, how can they access the pool? Yeah, because it's very easy. If you're able, it's usually straightforward. Yeah. But if you had some sort of disability, then there are different ways of getting in and saying if there is an emergency, how do we get out as well? Yeah. Do we use a board? Do you pull them out? So all of this needs to be as part of your initial assessment to them. So going in, there are different ways. You can use steps. You can go through the side of the pool. There are chair hoists. There's ling hoists. There are ramps. There are like lifts that you change to a shower chair. So different ways. It depends on the service. It depends on the individual as well, what they have to offer. But all of this needs to be addressed and and assessed by a qualified therapist once you're getting into the into water. Yeah. The other thing that is interesting is the way temperature impact. Of course, in the pictures, I look at very extremes. Someone relaxing in a nice hot jacuzzi, and then someone swimming in cold water. Yeah, but still, especially when we're looking at the neurological population, especially when we're talking with people with spasticity and high tone, this has a very high impact on the way the body reacts. Yeah. So usually if we get to cold water, we become a bit shivery and etc. So if you got someone who has got high tone, the tendency is that this will increase the tone then. So usually when we're talking hydrotherapy pools, the temperature is usually around 32 and 34 degrees. Yeah. And it doesn't look like much, but you can tell really well if it is 32, 33, 34, you can tell. Yeah. You usually say between 33 and 34 is very comfortable. 32 is nice, but a little bit fresh already. And 35 feels like a soup. Yeah, it's not comfortable for exercising. Yeah, if you're relaxing, then of course, then it's wonderful. But for exercise, no. If you go to a normal, like public swimming pool, we're usually talking somewhere between 27 to 29 degrees. Yeah. Because usually the colder the water, around 27, is ideal for swimming exercises because you end up having a little bit less resistance as well. And then of course, the more you heat, the more it's like our houses, yeah, that there are costs involved as well. Yeah, so every degree you ramp up, your electricity bills or gas bills, they will go up as well. Yeah, so this is quite important to have in mind. And some people, they will get involved if we have some neurological patients going to public pools and they will be fine. Sometimes they just need some adaptations, but these, again, it needs to be assessed there. You need to get the clients in water and see their response. And then there are some things that you should expect or not. But usually between 32 and 34, that's where hydrotherapy pools sit. Yeah. And then being in warm water, it means that there is a relaxation. Yeah, of course, our jacuzzi or hot bath is the extreme, but there is a relaxation component to it. Yeah, because it's more permeable. There is a relaxation, and then we can work with all these different stretches and manual therapies that we use, especially if you're working with gain of range, and relaxation is quite nice. So you got like a trunk stretch. That's the other thing. For example, if you got someone who is quite big or someone who is heavy, get this stretch, for example, the one on the bottom left there. It's very hard to do something like that easily on land, yeah, especially if it is someone heavy. But this girl, for example, the pitch is at least a head shorter than me, yeah, and she has got no problems there, yeah. To stretch and to get this full range of it. So it allows a lot of movement, allows a lot of access that you wouldn't have otherwise on land, or it would be quite hard to get on land. So this is one of the things in hydro in the Practise that I quite like. The idea that you can get someone supported, and then you can find these movements, or you can find this different stretching position and different ways to facilitate movement. The other thing is this, I always finding a bit controversial, to be honest. Yeah, walking training water. When you look at first, it's quite straightforward. Yeah, so you make it lighter, so it's easier to mobilize. And sometimes this is the rule, especially for musculoskeletal injuries. It is the case. Yeah, if you got elderly patients, it's usually the case. You make it lighter and it's easier to mobilize. It gives you access to movements that you otherwise wouldn't get. So you can explore a greater range as well. The other thing is because, let's say it's a soft environment, it takes much longer for you to fall. Yeah, so you've got time to lose balance, to recover. So you are not as apprehensive, you're not as anxious when you're doing this walking training in water. Yeah. And then you can start getting other implements. So for example, in this video in the center there, we're trying to stimulate a little bit more association, a little bit more of this crossed movement there, and then facilitate hip flexion as well. It's not the greatest video, but it's the one I could find there within quite upwards, but it just gives an idea. But there are a few drawbacks as well. Yeah, so in the same way as it makes it lighter, as I said, if you've got someone with an ACL, with a hip replacement, someone with just, is prone to falls, it's very easy. But the deeper you go, the lighter you get. And then you stop having, or you reduce the amount of reaction you have under your feet as well. Yeah. So sometimes if you, well, we all do, but if you're very reliant on the sensory feedback, you end up losing it. Yeah. Especially when you have someone with a hemi, for example, like a stroke patient, survivor as well. I'm always a bit, especially with the hemis, I'm always a bit skeptical. Yeah, if they are very mobile, then usually okay. If they're not mobile enough, I'm always a bit skeptical. There are ways of doing it, but yes, it needs to be properly assessed, and you need to think exactly what you want to get from getting the movement. What are you focusing? Is it on getting which phase of the gait you're trying to get? Which type of movement are you going to get? So it's goods and bads. And then, like with like Physio Online, we have different methods as well. There are some methods there are so many different types of exercises and methods and concepts, and you name it. There definitely is. For me, these three are sort of the main ones. Are the ones that are always there. Yeah, one is the Bad spring method, Helwig, it was developed in the UK, and Watsu as well. So Bad so this was great. So maybe I was talking about these monks in Switzerland that they started, and then eventually they created this spa treatment, and then so this is in the Alps in Switzerland, and they developed this method of treating people. They set a set of exercises, and then eventually someone brought some PNF techniques and diagonals, and they incorporated this into this method. Yeah, it's called the ring method because they use floats around the body and around the waist. I'm using noodles there, but they use rings, like donut type floats. That's why they call the ring method. And Bad is just the name of the place. Yeah. So the idea is all about facilitation and resistance as per PNF type of exercise. So there's a specific handling, and it's all about working on these patterns and work on strengthening and coordinating movement as well. Helwig, so Helwig is an adaptation system to get people into adapted swimming. Yeah, so they develop all this idea of the meta center and etc. So they explore this to teach people how to move in water. Yeah, and by doing so, this is incorporated into rehab. They learn, because you always have this intrinsic movement happening when you're water because of the movement of the water and the balance. You have to find your body, and by finding your body this way, you then incorporate. So they have a 10-point program that they teach you how to roll. They have some group sessions, and it's all based on these rotations and etc. and being independent in water. Yeah, and then they say, and then that's how everything is based. So you see that we don't have floats, but it's all based on you learning how to mobilize the body and have this intrinsic movement there. And then what is a relaxation method as well, concept? It's all passive, and it's usually it has to be a quieter session. But we use some of the movements during our sessions, but when you're having a full Watsu, like a proper Watsu session, it's one of these techniques that you need to be in the mood. Yeah, you cannot just come from a party and jump in the pool and and expect everything to be relaxed. Yeah, you need to get in the mood. There's usually some, I don't know, sounds of nature in the background, some new age stuff, some low lights. There's usually no conversation during the session. It's quite introspective, but it's very relaxing. So you have this sequence of movements. Yeah, they're all aimed at relaxation and stretching. And it feels really nice. If you get the chance, I will always recommend. And the course is always amazing as well. Yeah. So this patient, so as you said, we see at the Royal Bucks, we see all these different types of patients, brain injuries, stroke, spinal cord injuries, cerebral palsy, etc. Yeah. And you've been seeing all these different type of patients in water as well. Okay. It's wonderful to see them in the pool because you have this different sensory and perceptual input because you got the water, you got this, this light environment. It's usually an easy environment. Everyone tends to be a bit more relaxed. It's motivating, it's challenging. As I said before, especially with these big guys, like spastic guys, it's easier to mobilize and facilitate movement as well. Which is great there for spasticity management, especially in warm water, is very used with our spinal cord injury patients. Yeah, the fact that the movements can be slower, especially in standing, allows more time for you to explore the movement. Yeah. Again, pain management as well. You can use for re-education functional activities. We had some work with the OTs as well. They're doing some reaching exercises and transfers exercise. But sometimes it could be too difficult to do outside water. So there is a complement. And then especially for the neurological patients, especially for the spinal cord injury patients, it's an alternative to aerobic training. Yeah, especially if you don't have access to walking, or you cannot be standing or anything like that. Because when you think aerobic training, usually it goes into swimming, cycling, running. Yeah, or then you got some boxing, etc. But it tends to fall into this sort of categories. Yeah. So when you got someone who cannot cycle and he cannot run, then swimming becomes an opportunity. Not only swimming is one of the options, but it could be a set of exercise, interval exercises, and etc. But many of our clients, they get to the swimming pool as an alternative to get this cardiovascular training as well. But yes, there is, as I mentioned, there is reduced weight bearing sometimes, depending on what you're trying to do. Some people, especially neurological, they tend to get very anxious when they get to the water. Yeah, they say, "Oh, I don't know how to swim," and etc. So they say, "Look, you don't need to know how to swim." So there is a whole process of adaptation that you need to get. It all comes from your initial assessment, trying to grasp, what's that person's experience was before, and what are the expectations, how are they presenting. So usually the first sessions, there is a period of adaptation, get them close to the water, see how they react. Yeah, you need to have a qualified therapist to get someone, especially if they're heavy patients, especially if they have like high tone spasticity, especially with the hernias, tends to be quite hard as well. So the way you mobilize, because there is a risk of aspiration. If we have, for example, clients with tracheostomy, we have a few clients with tracheostomy. So all of this, you need to be there, yeah. And of course, getting in the water, getting to a swimming pool is not straightforward as well. Yeah, we need to think about how does that person reach the pool? How would they get dressed? Yeah, do they need assistance to get dressed? Is there space? Is there adapted space for that person to get? Do they need to bring carers with them? So it's very hard when we're looking for pools to have these heavily disabled patients. Sometimes it's very hard, not because that the pool is not there, but sometimes the access is not there, or the changing rooms are not adapted, or they don't have a hoist, and etc. And we see this on and on and on. And of course, there is the cost as well. There is a high cost involved for the client paying for the sessions, but also for the running of the pool. Yeah. And then we need to think when we have this, not only for, I put the neurological, but it's not only for the neurological. Well, we need to think is what are their objectives? Yeah, this is a complement to what they are doing on end. So no one works alone. Yeah, it's all together. We need to see what the objectives, what are the challenges that we have, and what can we get from this facilitation? Yeah, will the benefits, suppress the risks and the challenges and etc. And then we need to see what they're expecting. Yeah, we have last week we had the gentleman came to us and said, "Oh, this guy will be great for Hydro." And then we went to talk to him and said, "Look, I don't really fancy, I don't care." So then there's no reason. So it needs to have reasoning, yeah. And then this goes, if the person is getting to the pool, how often they are getting, and then what type of exercises, what type of approach you're gonna have. And even when I said on the very beginning, the selection of therapists, yeah, the sparing of if you got the option, pairing therapists and clients. Do we need extra assistance in the water or outside? So all of this needs to be taken into consideration. Yeah. So Hydro, I find it amazing. Yeah, it's a great complement. It's fun. You can explore so many more things that you wouldn't otherwise, but we need to understand how the bodies work in water so you can get the most out of it. And then this will be amazing. Yeah, but it needs to have clinical reasoning. And then on that, I just want to do a little bit of Marcelo. I want to invite you all. We are running a course of clinical reasoning in the aspect using PNF as a background for orthopedics and neurology. This is happening at the Royal Bucks in mid-October. Is a workshop. It's going to be Saturday and Sunday, and I'd like to invite you all. I'm going to leave my details here. If you're interested, just drop me a line and we can get. And with that, I'd like to thank you all for your attention. And yeah, I'm ready for any questions that you might have.
Thank you, Marcelo. That was really, really good. Very, very interesting indeed. And there's obviously a huge area there that I was certainly not aware of. So it's very, very interesting. Thank you for that. So we do have a few questions. So I'll just bring those up. Sorry, just 1 second. So the first question that we've got is from Colette, and it's she's asking, are there any recommendations for exercises to address thoracic kyphosis following secondary osteoporosis due to Cushing's?
Yes, perfect. Yeah, thank you. Well, that's it. If you got osteoporosis, especially if you got osteoporosis, and then if you have scoliosis and etc., you want to be in a supported environment. Yeah. Because you have to be quite careful with how you load and etc. So all these exercises, stretches and anything that leads into this postural control, because you have this. Well, first you have the support of the water, but second you're going to have this balance, and then you're going to direct your exercises towards this postural control. Try to get better alignment and postural control. That's where, both Padragas and Halwick, they work with, especially Halwick. So all your knowledge you have on land can be applied. The only way is the way you facilitate this movement is slightly different in water, because then there is more to explore, because you can explore the way the body moves. Yeah, especially if you have this alignment, this will tend to shift the center of gravity and center of buoyancy. So you can use that. Then look for this intrinsic movement within the spine, and then try to get this movement. So yes, it's one of the cases that we see quite. I don't see it so much in my clinic, but in the other clinics, it's very common to have this type of misalignment, scoliosis and kyphosis and back pains and all of that. This is very common, and yes, there will be a great opportunity to work. Yes, but It's very simple. It's a complement. It's just the approach we have is different on how we facilitate.
Brilliant. Thank you for that. Then there's a question from Robin. Do you have any guidance on a service user accessing aquatic therapy who has an ineffective cough or who has a tracheotomy?
Yes. So our service, we have our own guidelines there, but if you go to the CSP and to the Aquatic Therapy Association as well, they produce a guideline, and they have like they had an interview with a lot of different services, and they had a meta-analysis as well, where they look for the guidelines. So usually what happens is it depends on which stage of the winning process and how ineffective is. Yeah. So there is a high risk of aspiration. So of course you don't want to get, if you get a stomach, you don't want to get this stomach close to the water. Yeah. So usually we have 2 people in water, especially in the first sessions. It's usually at least 2 people in water to help with the support. Yeah. We always have either a third person or the therapist in water, or we have an assistant. There is always an assistant at a reach as well, but there is always a suctioning machine by the side. Yeah. So again, it depends on how the patient is and how competent your team is. You need someone who is trained to do suction and someone who is trained on ventilated patients to have that. You can either have someone with a trachea, you can have someone ventilated as well. But yes, there are some adaptations. Yeah, so I would say I can send you our guidelines, or you can look at the Aquatic Therapy Guide, Chartered Society guidelines as well. You can just Google, and it's the first one that shows up.
Yeah, sorry, and it's what was that Chartered Society again? Because someone's asking about a register.
Yeah, it's the ATACP, is the Aquatic Therapy Association for Chartered Physiotherapists. Yeah, brilliant. That's it's one of the networks from the CSP. Yeah, from the Chartered Society of Physics. Yeah, you can get that, but I think if you Google, it comes straight away as a guideline document. This was from, I don't know, 5 years ago, 4 or 5 years ago. Brilliant. Yeah, but it usually is. You need to have someone competent within that team around the pool. You cannot get, you need to avoid water getting there, and you need a suction machine by the side. That's usually what it is. Different services, they will have different processes as well, but roughly that's what it is.
Very good, thank you. And then another question, are there any contraindications for exercises when recovering from osteomyelitis or discitis in the lumbar spine with a 12-month-old wedge fractures at L2 and L3?
I mean, there are more precautions. Yeah, there are no contraindications to that. Yeah, it's about precautions. Yeah, I would say it's the same precautions that you would have on land. The only difference is you're going to be on a supported environment. Yeah. So once you are in the supported environment, once you're floating, actually, the tendency is to have a better hydration of the disc, and actually you're going to have a spacing between the vertebrae on the disc and between the vertebrae. This space is going to increase as well. So actually, it's just precautions, pain and etc. And of course, you're going to try and avoid these very fast change of movements, and this very fast and aggressive movements. You can avoid that, but otherwise any postural control, position changes and all of that will be quite indicated because you are in the supported environment.
Very good, thank you. And a question from Lenka. Do you have any advice what equipment we could use for a complex high-tone pediatric patient to be prone lying in the pool?
Yeah, so it depends what you have access. Yeah, so usually what we do get is noodles. Yeah, I tend to work with noodles only because I find it quite useful, and it's quite straightforward, and it's cheap, and it's so usually just build up noodles, and then it depends how big the child is, and then, well, to be honest, the ratio between the therapist and the child. Yeah, because you could, if it is someone who is quite tiny, you could facilitate from the trunk, from the rib cage, but you could facilitate from the elbows as well, from the forearms, to have this. So usually we have the therapist in front. But other places I work with kids, well, we had a platform and then we used to put floats on the platform and use that. There are different type of belts you can use, but to be honest, usually noodles, they work quite well. They have this, this life jacket style type of floats, but then the kid needs to have, good head control to do that. But you can do, yeah. And if they don't have control, you can still do it, but it depends on the size then, yeah. If you got someone who is, 3 years old is one thing. If you got someone who is 15 and it's 2 meters tall, it's completely different. Yeah? But you can even facilitate even from the chin if you want, because once your water becomes so light, you can even do. There was a picture then in the thing that was just facilitated from the head, for example. So you can do that. We can do traction as well. So yeah, so prone line is usually rib cage, chest, or forearm. If it is someone like if it is a baby, for example, if it is someone tiny enough, you can go from behind and just have your arm supporting the trunk as well.
Very good. That's very, very interesting. Thank you. That was it for the questions which came in on the chat. There was one more question which was around whether there'd be a recording and the PowerPoint available once the webinar's finished. We will absolutely make that available in the next few days. But that was it for questions that have come in so far. I just want to say thank you very much for that, Marcelo, and it has been very, very informative. It certainly opened my eyes, and hopefully many other people here, as to the benefits of aquatic therapy, and how it can really help people to rehabilitate quicker and in with much more comfortable surroundings. So that's it.
Perfect. I just want to say, because I saw a message there, someone saying that they are an OT in Hydro. Great. I've been trying to get our OTs in the pool for years. Yeah, it's been a struggle. Yeah, we've been trying to get them for so long. Sometimes I get them, but yeah, I've been trying to train them and they're very sleepy. So yes, so keep going, and then stimulate your OTs to get in water as well.
Yeah, and that register you mentioned, the ATCAP, I'm sure that'll have resources on there, won't it, for people who are looking to find other people who are involved in aquatic therapy?
Yeah.
Do you know of any other groups
or
registers?
Yeah, well, I mean, this is the main group in the UK. Yeah, there are other groups as well that you can get, but this is the main group in the UK. Yeah, it is an arm from the CSP. You have a little bit of access to the website, but if you want to have full access to all the guidelines and instructions and etc., then you can become a member at something like £20 a year or something like that. Yeah, we can become a member, but they are quite accessible, to be honest. Yeah, whenever you want to get them, they run. You don't have to do the course to become a hydrotherapist or aquatic therapist, but they run a foundation course, which is very, very interesting, and it's highly recommended. If you want to get into hydro, it's highly recommended that you go on one of these accredited courses, because they are based to it also. So they have a foundation course, and then they have intermediate type of course in neurology and one in pediatrics, if I'm not mistaken. So although it's not necessary, it's highly recommended.
That's very good, very helpful. Thank you very much. Thanks
Perfect.
again, Marcelo.
Thank you very much. Thank you guys for listening, for the questions, and yes, have a nice day.
Yeah, thank you very much. Have a good afternoon, everyone.